don't hypothesize because we just don't know. So we have no idea what he did or didn't do and how he got it. I'm sure that's going to be vital information to try to understand the transmission. But the idea that there's going to be a widespread outbreak here, I think, is just, again, it's a bit of fear-mongering. We have a single case.
Yeah. All right. Welcome to Gimme 5. Dr. Ezekiel Emanuel, the man who said that everybody should die at 75, or if they get Ebola at 25. You know, he didn't say that. But don't think that we won't hear that from his lips one day as well. To downplay this and to say it's fear-mongering, that to be afraid that this is going to spread like wildfire, I'm sorry. I'm not a doctor, but I certainly have that fear. I have a child. Do you have confidence in this president, in this government, in this CDC? They're more concerned about how the economy of the African countries are going to be affected than they do about keeping us safe, in my opinion. Or at least it sounds that way from listening to Frieden talk yesterday. Here's more.
The president said it would be unlikely if we had a case in this country. Unlikely to have even one case. Want to go back and see the tape again?
He said it wouldn't be an Ebola outbreak, and I think that's
no. And in the second part of his sentence, he said that in the unlikely case someone brings it here.
Yeah.
In the unlikely case somebody brings it here. Well, they've done it. We're living in the world of the unlikely already. That's all I'm saying. I'm not fear-mongering. I'm stating the facts.
That's right. Good for Chris Matthews. He's not fear-mongering. He's stating the facts. The president stood there and said, as he said, in the unlikely case that an Ebola victim comes here into this country. Well, we're there. A week after he said it would be unlikely, it's here. So it's unlikely that this is going to spread into an epidemic? Is that unlikely too? I'm telling you, folks, I just don't have confidence in anything that this man is in charge of. More.
We need to put it in perspective. This isn't easily transmitted. It's not like the flu. It's not like measles or chickenpox. You need contact with bodily fluids, and we have a health system that's much better prepared to prevent that from happening once the person's in the health system. Now, as you point out, before you get into the health system, there are chances where you're feeling sick. It's nonspecific. It's a fever. It's muscle aches, where you could be infectious, for those things, we need good contact tracing, and that's why we have the CDC, and we have good public health measures.
Yeah, all right. Listen, I went to the ear doctor today, and my ear doctor said there's one way to contain this, and one way only. You don't let anybody out of the African countries that are involved with this, that are infected with this. That's the only way to assure that it won't go anywhere else. Otherwise, we run a big, big risk. Here's more.
Okay, let's go down.
I would emphasize, Chris, if any American thought whatever happens over there, it's irrelevant to us, we don't have to really care what happens in West Africa, this shows you that's simply a false statement. While we're not at severe risk of having an Ebola outbreak here, what happens over there does matter to us for our health, but it also matters to us in terms of failed states, bad problems in other countries that could affect us. And we really do need to be much more engaged in other countries and making sure their health systems can work and can solve these kind of problems.
Yeah. Let's worry about other countries' health systems. And he said that we're not at risk for a severe outbreak. That's what he said now, a severe outbreak. What is severe? 10 people dying? 100 people dying? 1 million people dying? What's acceptable before you're worried, Dr. Emanuel? I'm telling you, they are more concerned with us helping these other countries, us sending troops there, pumping up their economy, helping their healthcare system. Us, if there's an outbreak here, why shouldn't we have one? We're no better than anybody else. It is insane. It is insane. The whole attitude is insane. I didn't get confidence from that press conference yesterday from the CDC director. Did you? I did not. Now we have the second person under observation. I mean, this guy didn't have symptoms when he got off the plane. And we can't know his name, God forbid. Do we know what restaurants he went to, what taxis he drove in? No. Privacy, right to privacy. Newsmax Now Update is next.